Okay, so Dr. Lucas here. We're going to do a quick case.
Hi.
Who are you going to be? Male, female?
Male.
Male. Name?
John Cole.
John Cole. So we're going to do an example 8-minute case. Let's say I'm in GP setting. Let's think I've got some past medical history. Let's say you haven't got that much to go on. Tension, headache, migraine, something like that maybe in the past. On any meds?
Shall I be on some triptans?
Yeah, okay. So it says Simtriptan, let's say you had a prescription last a year ago.
Sure.
Not been into the practice for 2 years?
Yeah.
3 years,
Okay.
so it looks like fairly fitting well. Fairly new presentation. What else do you need to know? Nothing else really. John Cole.
John Cole.
Great. 8 minutes on the clock.
Okay.
Hi, is it Mr. John Cole?
Yes, John Cole,
Hi,
doctor. Thank you for seeing me.
Hi, Doctor. I'm one of the doctors in the practice. Thank you for coming. How are you helping today?
Not great, doctor. I've had a cough for about 3 weeks now. I just can't shift it. I'm bringing up some horrible stuff, and my wife's told me I've got to come in.
Okay, yeah, cough, very, very important to get it checked out. There can be lots of different reasons for it happens. It's good that you've come. Your wife mentioned coming. We'll talk about her in a second. But good, glad you're here. Tell me a bit more about this cough in your own words. What's been going on? What's the story?
So I think it's getting worse. I've tried some over-the-counter remedies. They haven't shifted it.
Okay.
And I'm bringing up quite a lot of gunk and horrible stuff.
Okay, so again, the important things to come and see us about. I mean, people do cough things up and it can mean lots of different things. So I'm really glad you've come to see it. You mentioned 2 or 3 weeks?
Yes.
Okay, let's try and narrow the story down a little bit. You mentioned a cough.
Yeah.
How do you describe the cough? Is there any way you can think of?
It's wet. I'm bringing up yellow material, making me a bit short of breath at times, so I have sort of coughing fits.
Okay. So again, a couple of important things there to pick up on. You mentioned coughing up stuff. Yellow.
Yeah.
Has it been yellow since the beginning? Is that changing in colour?
Yellow since the beginning.
Okay. Thick? Thin? Sorry to ask these questions, but
thick.
They're useful for us. Nothing unusual like any blood?
No blood.
At all? Okay, you never really had this before, or have you?
No.
Okay, fine. So no blood, which is good. A couple of other yes/no questions, really, just that we tend to ask just to make sure nothing's going on of any worrying nature. Some of them might be related to the cough, some of them not. We talked about blood. Any fevers at all you've noticed?
Maybe. Been a bit hot and cold, but I haven't taken my temperature.
Okay, getting worse, better? Same for the whole period. Okay, fine. Any kind of lumps and bumps that you've noticed, maybe around the neck or under the arms?
No.
Good. Not felt off your food?
No.
Eating and drinking okay?
Reasonably.
Good. Any recent travel abroad? That can sometimes be important.
I wish. No.
Okay, yeah, we all wish. Stuck here in the cold winters. Fine. Weight loss? Anything you noticed?
No.
Nothing like that at all. Good. You mentioned not bringing up any blood. You did mention shortness of breath. Is that happening when you cough, or is it generally when you're out and about?
Just when I'm coughing.
Okay.
If I cough a lot, I feel a bit breathless.
Fine. No wheeze at all?
No.
And when you're kind of walking on the flat or going upstairs, does that cause you to be short of breath?
No.
Okay. And often with shortness of breath, you think about things like pain in the chest as well. Have you noticed anything like that?
No.
Good. So nothing going down the arm into the jaw.
No.
Nothing that comes on when you're exerting yourself, walking, etc.
No.
Good. And nothing strange like pain when you take a deep breath in?
No.
Okay, and a funny question, but definitely related. Any problems in the legs, for example, either pain while you're walking or any swelling or tenderness at the back of the legs?
No.
Good. So all that seems fine. Okay. Generally, you said you're eating and drinking okay, not vomiting.
No.
Okay. Tummy feels okay.
Yeah.
Good. Excellent. Thank you. Sorry for asking you lots of questions there.
Okay.
Let's get a bit of an idea about what's going on in your mind then. So you've had this for 2 or 3 weeks now. What kind of thoughts were going through your mind?
Don't know if it's a chest infection, maybe.
Reasonable. Yeah, reasonable thought. I think a lot of people think, particularly this time of year in the winter, chest infection. So we'll have a look at you and see if that could be going on. It may well be. Anything particularly worrying you? I noticed you don't really come to see us very often. So anything on your mind at all?
Yeah, I mean, I just don't want to get into hospital at Christmas time. I want to get well.
Yeah, that seems very reasonable. I think who would want to go in on Christmas time? So yeah, it's good that you've come. Let's try and see if we can stop that maybe happening, if there's something that we can do for that. And obviously you've mentioned some remedies and things and treatments you mentioned at home, and we'll talk about what they are in a second. But was there anything particular that you thought that we could do when you came today?
Don't know if I need antibiotics, maybe.
Very reasonable. If you're thinking infection, that is certainly sometimes we do treat it with antibiotics. Maybe once we've checked whoever we can see. Now you did mention some treatments that you tried yourself. Just tell me what kind of things they were. What was the impact of them?
Just cough syrup.
Okay.
Didn't change it.
Didn't really touch it. Not need anything like paracetamol, for example, for the temperatures.
I tried some
but not just the cough.
No, yeah.
Absolutely. Okay, fine. And I've looked at your notes. I can see that you don't really take many medications. You just take some for your migraine.
Yes.
Is that all under control?
That's all fine, doctor.
And no new medications that you've tried for anything else?
No.
Because sometimes cough can be caused by certain things. And because we sometimes treat, and you mentioned antibiotics, any allergies that we need to know of?
No.
Any lung problems running in the family, chest problems, heart problems, lung problems? Good, fantastic. Thank you. Lots of questions asked there. I'd like to, if it's okay, maybe examine you, but before we do, just a bit of about the impact about what is happening with you. You mentioned home, you mentioned wife.
Yeah.
Who else is around with you at home?
Daughter.
Daughter, 18. Okay, 18, okay, fine. And what have they been saying about this cough? Anything at all?
Get to the doctors.
Fine. Do they have any thoughts as to what could be going on? Any worries?
I don't know.
They're not
really.
too, but okay, fine. And what about, has it been impacting work in any way? What do you do for a job?
So no time off work,
Good.
which is good. I work in a carpet factory, so a lot of dust around.
Okay.
I think that's been irritating me.
Okay, so that's interesting. Dust can make it a little bit worse as well. But has the dust situation changed, or has it been the same over a long period of time?
Long period of time.
Okay.
Just feel more sensitive to it with my chest.
And one important piece of question to ask, you mentioned dust, carpet fitting. Have you been working in buildings with asbestos, etc. in the past?
Don't know, doctor.
Okay, fine. It's just something we tend to think about when people come in with coughs, but it's good that you haven't been. So you mentioned home, you mentioned work. A couple of habits can make things like coughs worse, particularly things like smoking. You've probably been asked before.
No, never smoked.
Never smoked, okay. And certainly because we're thinking about maybe treating this, things like alcohol can impact certain types of treatments. Can ask if we drink at all?
1 beer a week, doctor, if I'm lucky.
Okay, fine. And is it impacting you in terms of hobbies, for example, in any way whatsoever?
No.
Okay, fine. So otherwise, it sounds like you're getting on with life as normal. It's just a bit irritating, and it's been there for a while, so you want it cleared. Great, makes a lot of sense. Before we talk about what we can do about it, do you mind if I have a quick look at you?
Yeah, sure.
What I'll be hoping to do is maybe firstly have a quick listen to your chest, listen to your heart, what the cardiovascular respiratory system, check a few numbers, oxygen levels, breathing rate, heart rate, blood pressure, temperature, and have a quick feel maybe around the sides of your neck. Would that be okay?
Absolutely.
Great. So Scott, thank you so much for letting me examine you. I know I asked you a lot of questions as well. I appreciate you spending some time going through all of those. Reassuringly, nothing worries me too much from looking at you. Your temperature's good, your heart rate's good, your oxygen levels are perfectly fine. I'm happy with all that side of things.
Good.
When I listened to your chest, I did hear a few little crackles, actually, what we call crackles at the base of the lung. So actually, you did mention a chest infection, and I agree with you. I think you have got a chest infection. We do see a lot of them at this time of year. I don't think it's anything too worrying. Like I said, your numbers seem fine. Your story doesn't highlight anything alarming of any nature. And I think it's something that we can quite easily treat, which I'd like to do. Chest infection you mentioned before, is that something you have heard of, or you have much experience with these in the past? Do you want me to go through what it is?
No, I think I understand it.
Okay.
Yeah.
So there's two main types. We have a viral chest infection, we have a bacterial chest infection. And I think given that you've got the crackles there, given that you've got the phlegm that you're bringing up, and given that it's been 3 or so weeks, we're probably veering towards thinking about treating it as a bacterial chest infection. So I'd like to talk about a couple of things. Firstly, some antibiotics.
Okay.
I'd like to go through what we'd like to prescribe, some side effects, how they work, and the plan with those. But also you mentioned work seems to be triggering it at the moment, and you mentioned the dustier environment, and I wonder whether maybe talking about a little bit of time off might be useful just while we maybe treat this, and we can talk about implications around that as well going forward. And also before you leave, I'd like to talk about a couple of symptoms just to stay ahead of, look out for, that would mean you come and see me if things get worse, because chest infections can change and get worse even though we're treating you. So if that's okay, I'd like to focus on those main things, but because you've got the symptoms, because it's been there for a while, let's maybe start with the treatment first.
Right.
The guidance for this tends to suggest an antibiotic called amoxicillin.
Okay.
You mentioned you're not allergic to anything, which is great. It's a 500 milligram tablet, which you take 3 times a day for 5 days.
Okay.
So I'd like to start that if that's okay.
Yes. Yeah.
Have you heard of that before, or do you have any questions about the treatment?
No, I'm happy with that, doctor.
Okay, so maybe we can get that prescribed before you leave today. And like I said, maybe work. How do you feel about a bit of time off? I know it's a busy time of year, like you said.
I think
but
that would help
do you
actually
think so?
to get me back on my feet a bit.
Okay. And are you self-employed or